Hello class, welcome to Chapter 10, External Control of Long-Term Care. Let's take a look at the learning objectives now and then as usual review them when you're done reading the chapter. External controls can be divided into two categories, public and private. Public controls result from passage of laws. They are non-voluntary and are imposed by government agencies. Private controls are provided by non-government agencies and organizations, and compliance is voluntary. Public or government control mechanisms includes regulation of long-term care providers and licensure of individuals working in the field. Regulations vary from laws primarily in their specificity. A legislative body enacts a law and an agency enacts regulations to implement that law. Who regulates and why? Regulations are imposed by a government unit, federal, state, or local, including county and municipal, because of the responsibility of that unit to protect the welfare of the public, particularly those that the government judges to be unable to protect themselves. So let's consider a regulatory agency in the state of Illinois. Who is the state regulatory agency that comes into nursing homes and does the annual survey? That would be the Illinois Department of Public Health. Each state has their own state agency, and they enforce the state regulations as well as the federal regulations that belong to or come from CMS, the Center for Medicare and Medicaid Services. Anyway, moving on here, this protection covers two primary areas, quality and payment. Long-term care has a great deal of regulation, more than many other fields of endeavor. There are several reasons for the relatively heavy regulation of long-term care. Regulation of quality. Ensuring quality of care is the primary reason for regulation of long-term care. Defining and measuring quality. Quality of care is subjective, including both technical and personal components, and varying from individual to individual and situation to situation. Most measures of quality fall into three categories: process, structure, and outcomes. Who should measure quality? Historically, most quality measurement has been external in the form of mandatory licensure, surveys, and reimbursement-driven regulations. So the types of quality regulations. Most regulation of quality of care in long-term care organizations originates at the federal level. Medicare and Medicaid account for a large portion of federal regulations dealing with quality of care. The primary role of state government in regulating long-term care quality is as the designated agency administering federal programs. Municipal or county agencies also have an interest in ensuring the quality of care received by consumers of long-term care and are usually represented by health departments. Okay, regulation of payment. Nearly as much attention is given to avoiding excessive payments, saving money for government agencies, and preventing fraud and abuse in government funding programs as is given to protecting quality. Medicare and Medicaid are the preeminent sources of regulations when it comes to controlling payment for long-term care. Government agencies regulate payment by channeling it from provider groups that they see as high expense to those who are less costly. Health Insurance Portability and Accountability Act. The purposes of HIPAA are threefold. Number one is to provide consumers with great access to health care insurance. Number two is to protect the privacy of healthcare data. And number three is to promote more standardization and efficiency in the healthcare industry. Other regulations fall into two primary categories. There are regulations protecting employees and regulations protecting the environment. Licensure of individuals are licensed by the states rather than by the federal government. Healthcare professionals are licensed to practice in most cases throughout the continuum of care, not just in long-term care. Practitioners specific to long-term care, certified nursing assistants are not licensed but certified. Long-term care administrators, which are nursing facility administrators, and increasingly assisted living administrators, must be licensed by the state in which they work. Efforts to resolve the confusion over licensure. There has been significant progress towards increasing the uniformity of state licensing regulations, removing some of the confusion, duplication, and fragmentation. In some cases, it is also making them more strenuous. This progress has primarily been the result of efforts by several organizations, including both government and private, federal and state. Regulation pros and cons. Regulation of long-term care has its supporters and its critics. Those who favor regulation cite the need to protect consumers from historic abuses and from excessive costs. Critics argue that the current system of regulation is ineffective. Problems associated with uncoordinated regulations. They have been created at many different times by many different agencies for many different purposes. One regulation may conflict with another. There is a need for coordination. When we consider finding a happy medium, it is an extremely complicated and difficult issue that does not lend itself to quick fixes. Policy issues. There are several policy issues related to regulation, including the need for a balance between regulation and innovation. Shifting the focus to the consumer, is that a good thing? Shifting or management of care, who should be the gatekeeper? Private control mechanisms. There are several private organizations involved with controlling providers of long-term care. They include Accreditation, the Joint Commission, and CARF International. Private certification. There are numerous private organizations involved in certifying the competency of individual healthcare professionals and practitioners. They measure against standards set well above minimum acceptability. They ensure that certified professionals are competent in their areas of specialization and are well qualified to practice their profession. Okay, now take a look at the summary here and then please read the chapter and review the learning objectives once again. Thank you.